Hello everyone, this is Dr. Shishma Sarula, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss about what is the connection between menopause, perimenopause and this bulky uterus. You have to remember that perimenopausal stage and the menopausal stage do have fluctuations, which is hormonal fluctuation. So what happens, the amount of estrogen is slowly decreased and so is the progesterone level, and then slowly the uterus from the normal size it goes to a little bit smaller size, and then you stop having your periods and there is hot flushes, there's acne, there's hair fall because of this fluctuation. This is the normal process, right? Some people experience it, some people do not even have change, they just have cessation of menses, right? So what happens, what is this hormonal fluctuation that can cause a bulky uterus in some people? We will see that. See, estrogen and progesterone fluctuations are common in perimenopausal and menopausal stage, but these fluctuations can cause increase in the uterus lining because it can be because of fibroids which are already existing in your 30s or in your 40s, or because of adenomyosis which you're already experiencing. Usually people who are suffering from fibroids and adenomyosis can land up into bulky uterus in their perimenopausal stage or in their menopausal stage. Apart from that, what happens whenever there is fluctuation, usually the uterus size should start to decrease, but what happens because of the stress level, it acts otherwise and there is increase in this level, or because there is severe stress and the cortisol is increased, which can cause increase of cortisol can cause estrogen production in the belly fat, which can increase to estrogen production in the belly fat can increase, and E1 will increase, which will cause estrogen dominance, and it will cause uterine lining to thicken up because there is no progesterone production more in the perimenopausal or in the menopausal stage. So there is thickening. And apart from thickening, what happens whenever there is estrogen without progesterone, the endometrial level will start to grow like it has no opposite force to stop it. Okay, and then this perimenopausal and postmenopausal stage fluctuations will add up to the thickness of the uterus. Apart from that, you have to understand people who are using oral contraceptives from a very early age, like teenage, or people who are using oral contraceptives for a longer period of time can also experience bulky uterus or fibroids or adenomyosis in the later ages, that is in the perimenopausal or in the menopausal stage. Usually fibroids start to decrease in the menopausal stage. So mostly if you're using oral contraceptives for a longer period of time, you will start, many people can start experiencing fibroids and adenomyosis or endometriosis or these bulky uterus changes in their 35s or 38s. Coming to the consultation options here at Fidicus Homeopathy, we have two kinds of consultation options. One is online consultation, the other one is offline consultation. If you're someone who's staying nearby the nearest branch of Fidicus, you can come and contact us in person. If you're staying far away from us, you can contact us online either through audio consultation option or through the video consultation option. Once you've contacted us and you've taken doctor consultation and investigations are verified, especially to the online clients, medicines will be door delivered to you. If you're staying in India, it can take 3 days, 3 to 4 business days. If you're staying in USA, 3 to 5 business days. Apart from that, across the globe, you can have 4 to 8 business days for our medicines to reach your doorstep. If you're someone who is suffering from bulky uterus or any other female reproductive organ diseases, you can contact Fidicus Homeopathy. This is our number. You can call us, WhatsApp us, or message us on this number. Apart from that, if you want to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. So here we have discussed how homeopathy is much better form of treatment than the conventional form or other forms of treatment, right? And how homeopathy is much effective and also much safer. Right? In homeopathy, why should you choose Fidicus Homeopathy? Because Fidicus Homeopathy stands for highest chance of health. Here we follow 3 clear principles. What are those? First one is high success rate. We are already experiencing high success rate in treating bulky uterus, in treating adenomyosis, endometriosis, fibroids. So the success rate is really good. And apart from that, the treatment here is transparent. There is no gray area between the patient and the doctor. Everything will be clearly explained to you. The prognosis will be explained to you. And the personal care here at Fidicus Homeopathy is top notch. Any sort of queries, any sort of myths that you're having, any sort of doubts that you're experiencing, or any symptomatic doubts that you're having, everything will be cleared out. So if you want to choose cure, if you want to choose health, choose Fidicus Homeopathy.
Fidicus Homeopathy.